I am Dr. Mike Milligan. We are here at the American Academy for Oral Systemic Health inaugural meeting. And one of the keynote speakers, Dr. Lee Ostler, is with me now. Lee, thank you so much for being with us.
Well, thank you for letting me be here with you. This is a great meeting.
Oh, it's been a phenomenal meeting, and we're just winding that down. You'll hear a little background noise, but Lee was one of the keynote speakers, and he has DentalETC, and you need to hear about this. Lee, why don't you tell us about DentalETC, how it came about, and then what it does for us?
I'll be happy to do that. MyDentalETC is a software program that basically came from a need. You know, that's where all good things are invented from, is a need. We started many years ago interacting with physicians kind of the old-fashioned way.
Sure.
Using computer programs like Word and Excel for the database.
Sure.
And very manual, very cumbersome, very frustrating.
Yeah.
And I've got some smart people around me and my family that I asked the question, can we do this in a more automated way? And
right.
Obviously they said yes, and so we automated the system and developed an ability to create communication systems for other healthcare professionals and with other healthcare professionals. And then in terms of implementing the science, we decided to take that one step further and create an electronic treatment coordinator or protocol software.
Right.
And so the genesis of that started with just an ability to, or desire to want to get the oral systemic connection and the different medical and dental disciplines hooked together,
right.
But to do it in an automated way that made it simple and quick and would facilitate the interdisciplinary care between health professionals.
So you can use templates or you can customize it to whatever level you want, and it's a software program where you go in with your exam and you check this, you check that, and
right.
Continue on from where you go with it.
That's right. It starts off, the whole concept is it's based on the science.
Yep.
There's three principles to this. It's about the science, it's about the systems or protocols, and it's about building networks with other healthcare professionals.
Right.
And so from a science point of view, that translates into doing a proper exam. So
exactly.
If you have a pilot's checklist that represents the science,
right.
that lets you go through and identify all the risk factors and the clinical findings for whatever it is that was with that patient,
right.
Then you go down the checklist and just click everything that
right.
applies. Whatever's there for that patient, it's there.
You're right through that exam.
Exactly.
Yeah.
And then when I make the diagnosis, whatever the case type is or the caries risk category based on the Camber model or whatever it is,
Right.
what's preset in the settings is the individual user's protocols.
Right.
So they can go in there. That makes this a utility so that the user can set their protocol how they want to treat that patient. Visit 1, visit 2, visit 3, what products to use, what procedures to use, etc.
Including the fee, everything.
It's all in there, and the advantage to that is once I do that, once I go through the exam, once I make the diagnosis and I tie it to a protocol of how we're going to treat that problem
right.
in the office and print the protocol's for my team. Now they're all on the same page.
Right.
And what we're trying to do is to avoid protocol drift, where we start off with a great diagnosis, an accurate treatment plan, then it gets lost in translation, we get pushed back for financial and insurance reasons, and pretty soon, 6 months or 3 years later, we're doing bloody prophies again,
right.
in hygiene or inadequate care because of the issues.
Happens all the
time.
It
just drifts.
You bet it
and it's hard to recover from that. And so everybody's on the same page, and the doctor's philosophy of care is never in question in the office. Nobody's second guessing that.
Right. And then it does a number of other things then. You can show the patient their treatment plan. You can then also use this to send letters to their physicians or other people that are involved in the care.
That's right. In the modern world of medicine, it's about personalized care.
Right.
And so based on what their issues were, the pilot checklist that we clicked on, whatever it is there, that sweeps in and builds a report and gives the clinical relevance of each of those risk factors that they have. And so I can now immediately print a report that tells them their diagnosis and why their risk factors matter and what their clinical conditions mean, as well as what the consequences of no treatment or less than adequate care would mean. It's all right in there. And then the next step is it's just a real quick click the next button and you're into writing a letter to the physician, and there's a drop-down list of categories of letters by perio, caries, oral cancer, TMD, sleep, whatever the subject matter is. They're all pre-written in there, or you can load it, edit it, resave it, so you can build your own library of letters along with the your own database of other healthcare professionals, physicians, dentists, and so
So you
forth.
just click send it to this one and this one and this one.
Yes, and that merges it all together so you can print it, which then can be faxed or sent to the physician in a quick way, and you're on to the next patient.
Exactly. Is there anything else that you'd like to tell us before we close here?
Well, I think the importance of this is to know that the science is what's driving this.
Right.
You know, when we talk about how do you interact with other healthcare professionals, sometimes dentists get a little leery about, you know, going to physicians and either asking them for their time or, you know, telling them what they should already know or whatever. We get a little fussy about that, and the point is it's not about us, it's not even about them, it's about what the science demands.
Right.
And so
it's about caring for that patient, so it's important to do this.
Exactly. And so, for example, when I walk in and try to introduce myself to a physician, you know, if I'm going through the front door and introducing myself, I take with me tools, which is basically the science. It's the bibliography. We call it a physician's resource manual.
Right.
That's what I give to the physician, because I want him to know that I know this stuff.
Right.
And he can gather that by what I'm giving him. And I just flip through the bibliography. We have over 1,000, at this point in time, we have over 1,000 citations and 200 pages in a 3-ring binder, and I give that to them.
Right.
That is my calling card.
Right.
And I'm just there to solve a problem. I'm there but to educate, but to build a relationship,
Right.
so that he would trust me, saying, now he knows how to screen, for example, periodontal disease, or it could be TMD or whatever.
Right.
He knows there's somebody in the community that understands this, and we're working on building that relationship.
Become a team to help those patients,
And which is what it's all about,
That's right.
is to improve the patient care.
That's right. That's right. Okay, Lee. Well, how do we get a hold of you and get a hold of you to use this service, to purchase the service, or to learn more about the service?
We do have a website, www.thedentaletc.com.
Great.
There's plenty of information on that site and some videos, some tutorial things that can take the site visitor through, where they can kind of get a taste for what is dental ETC, what does it mean to do interdisciplinary care, physician referrals, how to build professional referral networks.
Right.
That's the new era in dentistry.
Absolutely, it is.
And we have to know how to go there. The 3 rules of thumb that I have is, if you're going to work with other healthcare professionals, you need to speak their language,
Right.
which is obviously the science. You need to know how to approach them and have the right tools in hand, and you need to play in their playground.
Yeah.
You know, those are all important rules, and if you don't have that, you're stuck.
And these tools help us with the ability to do that.
They're just simply tools. They're ideologically neutral. You don't have to espouse a certain way of belief, you know, one way or the. That's not what it's about. It's about building relationships, and then the user gets to define their protocols, their letters. It's just a utility. It's a software to help them execute.
Lee, thank you so much for
Thank
being
you,
with us.
Mike. Appreciate it. Thank
All right.
you.